I want to acknowledge our university and community supporters, the University of Iowa's International Programs and the University of Iowa's Honors Program. They contribute vital time, talent, and logistics to our organization. I also thank the Stanley UI Foundation Support Organization for their financial support, and I thank today's special financial sponsors, Cartha and the University of Iowa Community Credit Union. Our programs are made possible by the financial support of these sponsors. I am pleased to introduce Katherine Ryken. Katie is a third-year medical student at the Carver College of Medicine. She plans to pursue a residency in obstetrics and gynecology with a focus on global health and human rights. Katie is the past president of Carver's chapter of Student Physicians for Human Rights. Katie was the only student to be awarded a Fulbright Study Research Award to Bosnia and Herzegovina in the 2014-15 year, where she pursued research in post-traumatic injury and worked at primary care clinics serving survivors of sexual violence during the war. She is also a certified member of Physicians for Human Rights Asylum Network and completed training in forensic medical services for asylum seekers. She is pursuing both the Global Health Distinction Track and Research Distinction Track in the College of Medicine. Please join me in welcoming Katherine Ryken.
Good afternoon. Thank you for having me here. So, as Karen explained, I spent the last year in Bosnia-Herzegovina on a Fulbright fellowship, and the first time that I ended up in Sarajevo was the summer after my first year of medical school, and I was really interested at that time in working within a healthcare system that had faced all of the problems in a post-conflict society. And after spending time there, what I grew to realize is that while we tend to think about remnants of warfare as being physical things like landmines that are left in the ground, unexploded munitions, a destroyed healthcare system, an infrastructure that has yet to recover, what I grew more interested in were the hidden effects of warfare that are both medical and psychological in all of the survivors after conflict. And this was the basis of all of my work in Sarajevo. So my research was really focused on a fortuitous connection that I made with the University Clinical Center in Sarajevo with the Department of Orthopedics, and we were studying chronic osteomyelitis, which is a long-lasting bone infection, essentially, that's common in post-conflict countries as a result of the multiple open wounds. While being there, I started working a lot with the community, and my community project was with several different NGOs who work with women who were raped during the war. And this really became the focus of what my passion was. It kind of switched me from thinking I was going into orthopedics and neurosurgery maybe to a path of very, very positive. I wanted to serve women and do obstetrics and gynecology. So it really was a career-changing year, I will say, and I'm happy that I get to share some of it with you today. So today we're going to be talking about the role of sexual violence in warfare, and we'll talk about it a little bit generally, and then I'll focus specifically on its role in Bosnia-Herzegovina. Then we'll talk a little bit about the health consequences of rape in general and also related to warfare. The information there is scattered at best and not very well researched in general. And then I want to talk about transitional justice and what our role as physicians is in that context of that concept. So, sexual violence is not new and it's not unique in combat. This has happened for many years, since war existed. Historically, however, there's been little international protection or validation of women who were sexually assaulted during war. The Nuremberg and the Tokyo trials, they hardly even mention sexual violence against women, even though as Europe was being liberated by fascism at the end of World War II, one of the most infamous incidents of mass rape ever happened in Germany, where 2 million women at least were reported to be raped by advancing Red Army soldiers, and 100,000 women alone were raped in Berlin. It's really not discussed. It's a very taboo topic in pretty much all countries. And the consensus amongst leaders in general has often been that sexual violence is a byproduct of warfare, an inevitable thing that's going to happen to women, rather than part of the destructive force of war itself. And this is just simply not true at all. Sexual violence is used specifically as a weapon of warfare because it can be used to win and maintain control over civilians and territories, and it's used to destabilize populations. So these are the different ways that sexual violence is really used as a weapon of warfare. It can be used as a weapon of genocide in an attempt to remove one civilian population from a certain region. Women, especially in Bosnia-Herzegovina, there were many incidences where women were raped to occupy their wombs with the superior race and to prevent them from propagating their own inferior race. The opposite has also occurred, so the most notable incidents being in Auschwitz, where sterilization and forced abortion procedures were enacted on women in order to keep them from propagating their own inferior species. So it's been a tool of genocide as well. It's also used to humiliate populations. A lot of times sexual violence in warfare is done in front of people's families, in front of their friends, in front of other members of the community. There will be rape of the elderly, which obviously serves no reproductive purpose. It's merely meant to humiliate and terrorize a population. It can also be used to instill fear and force expulsion of communities from their own territory. So it will be done in public, outdoors, in broad daylight commonly during warfare. And this is basically to promote entire communities leaving. And it can also be used as a form of torture. So women or men can be asked for information and punished by failing to provide that information through rape. So now I'm going to attempt to give you a brief history of Yugoslavia in 45 seconds, which this is one of the most complex geopolitical situations on the face of the planet, so bear with me. So the Kingdom of Yugoslavia comes into existence after World War I. It's a nation of 6 communist states. They were all united in the 1940s by the partisan leader, Josip Broz Tito. The nations were united under his iron fist of communism. Everyone enjoyed a relatively high level of education, healthcare, and a functioning economy at that time. After Tito died in the 1980s, there wasn't really anyone who could provide the same unification of the states. And so nationalism starts rising up primarily in Serbia, with the government becoming overtly controlled by the Serbian Communist Party. And that kind of makes Slovenia, Croatia, and finally Bosnia-Herzegovina declare independence from Yugoslavia. So multi-ethnic Bosnia-Herzegovina, as you can see from this map, has a lot of territories from both Serbs, Muslims, and as well as Croats, more in the south. So the Serbs and the Croats don't want to lose any territory, so that's why everything kind of culminated in Bosnia-Herzegovina. So once Bosnia declares independence, the Bosnian Serbs, backed by the Federal Yugoslavian Army based in Belgrade, they surround Sarajevo, besiege it, and mobilize forces within the country. And as the war spreads through the country, this results eventually in a campaign of ethnic cleansing, which is where the term was kind of coined, in the north and eastern parts of the country in order to secure them as Serb territories. So between 1992 and 1995, over 2.2 million people are displaced. Between 100,000 and 200,000 are killed, 80% of them Bosniak Muslims. And as early as 1993, we start hearing these reports of pervasive patterns of rape that are so overt that it becomes clear it's it has to be part of some sort of government policy. And that's the brief history. So it was unclear, though we were getting all of these reports in the outside community of all of these acts of ethnic cleansing, it was unclear whether or not, according to international law, the acts actually constituted genocide by definition. And that is until 1995 in Srebrenica, which was a UN-declared safe zone. 8,373 men and boys were rounded up and summarily executed. One person has been added to the memorial since I was there. So as Srebrenica falls under control of the Bosnian Serb army, about 20 to 30,000 civilians who have taken refuge in Srebrenica as it was a UN safe zone, women, children, elderly, they all flee to Potocari, which is the compound where the UN protective forces were stationed. So an unknown number, but thousands upon thousands of rapes were committed as Serb soldiers entered the compound, threatened, beat, raped women, oftentimes in front of peacekeepers. Srebrenica's men are commonly memorialized. There's a big, beautiful, expensive memorial to the 8,000 men and boys, but we rarely talk about the women who were raped during that exact time. And in fact, the women who survived Srebrenica have the highest rates and the most severe symptoms of PTSD of any group that survived during the war. So it's estimated that up to 60,000 were raped in Bosnia-Herzegovina during the war. And it's really difficult doing this kind of work because we don't even know what that number is measuring. So it certainly can't be the number of rapes that occurred total, because women who testified say that they were raped up to hundreds of times, that they couldn't even count the number of times that they were raped if they had to. And it's certainly not the total number of people who were raped, because we don't know how many times women were raped, beaten, and tortured and killed afterwards and left in nameless mass graves. So it's very difficult to know exactly how many women and sometimes men were really affected by this policy. So these are photos from the criminal tribunal, and they are rape camps, which were camps that were set up in restaurants, motels, public buildings, schools, many of which are now being utilized for their original purpose once again. And women were kept there, detained, repeatedly raped. They would be taken out of the detention facility to a soldier's apartment, kept there overnight, taken out and raped by multiple people, and then detained once again. There are also cases where women were raped, impregnated, and detained until abortion was no longer possible. These are all testimonials that came from the International Criminal Tribunal for the former Yugoslavia, as well as lower courts. So the ICTY, it was founded in 1993. It's a United States court of law for war crimes in the Balkans in the 1990s. And it was the first war crimes court that was ever created by the UN, and it was the first international war crimes tribunal since Nuremberg and Tokyo trials. So I was lucky enough to go to a trial at the ICTY. It was Ratko Mladic's trial. He was the Bosnian Serb general who ordered the siege of Sarajevo, as well as the massacre at Srebrenica. So it was a really interesting experience. And the ICTY has really faced a lot of controversy in the past. Many are not under the opinion that they have brought as many people to justice as they possibly could have, amongst other reasons. But the ICTY is incredibly important, and it's for this reason. So the crimes that were committed in Potocari that I just discussed, all of the rapes that occurred alongside Srebrenica, those rapes were ruled that rape can in fact be a part of genocidal policy. So members of the Serb armed forces had utilized it as an instrument of terror, and this is the first time that this was said in international law. So, as I said before, this is really the first time that the international community is owning up and saying rape is an instrument of genocide. It's not simply a mere byproduct of warfare that's unavoidable, and it can be prosecuted. So it is important despite its misgivings on occasion. So this brings us to the concept of transitional justice. If you're not familiar, it's essentially a concept that was originated in the 1980s in response to human rights violations, primarily in Latin America. And it was a decision by the human rights community, essentially, that says communities that have been affected by systematic human rights abuses require many years of transition towards justice and towards stability, and that we, as the international community, have an obligation to those communities to assist them during that time. So the obligations of the international community included prevention of violations in the first place, investigating them once they occurred, imposing sanctions on those who were responsible, and ensuring reparations for victims, which includes access to quality health care from my line of work. So the belief of healthcare as a human right, which really drives a lot of my personal work, it demands that high-quality medical care and social services is available to survivors of conflict. And this is especially important for women who have really not been validated in the past and characteristically don't receive the best medical care. So the long-term consequences of sexual assault is globally not very well documented. There's a lack of systematic research on the topic, and we know even less about the chronic consequences, like long-term follow-up of what happens. We do know, however, that the two most positive predictive factors for post-traumatic stress disorder are experiencing war and experiencing sexual assault. And so these women have experienced both of those things. In addition, PTSD symptoms can be exacerbated by all of the stressors in a post-conflict zone, like a poorly functioning economy, an inability to get a job. All of these different things that result from that creates this multi-layered trauma that causes much more severe symptoms and more common comorbid psychiatric conditions like depression, anxiety, somatization, so like the physical manifestation of these things. So there have been studies that were done with survivors of non-war related rape, and not very many, to be honest, but it has demonstrated that survivors do experience increased rates of chronic diseases like diabetes, arthritis, and chronic pain syndromes, as well as the obvious manifestations of STIs, sexually transmitted infections, and unwanted pregnancy. So there were some studies done in Albania, Kosovo, and Bosnia in 1993 that identified there were similar findings to victims of non-war-related rape. And in addition to those, women who were raped during wartime experienced higher rates of rectal and genital traumatic injuries, higher rates of bladder and rectal insufficiency, so incontinence, inability to hold your bladder or your stool, traumatic fistula, which a fistula is essentially a hole between two organs that's not supposed to be there, so you can get a rectovaginal fistula or a vesico-vaginal fistula, so between the bladder and the vagina, or the rectum and the vagina. And this causes massive amounts of incontinence. It's an incredibly stigmatized disorder because you're constantly incontinent. So very sad. Also, sexually transmitted infections were at higher rates, and women experienced increased rates of precancerous dysplasia, cervical cancer, and breast cancer. And given what we now know about the HPV virus, these things may be related as well, especially the cervical cancer. Okay. So one of the organizations that I worked with was called Medica Zenica, and this is their director, Sabiha Hušić, and they published a study in 2014 called We Are Still Alive, and it's the most comprehensive study that's been done with survivors of war rape long-term in Bosnia-Herzegovina, and they interviewed 51 survivors. So I think that this demonstrates that we really need to do better in following up with these women and doing better research, because if this is like the greatest thing that we've come up with, like, we can do much better. But that being said, it's a great study. They utilized the Harvard Trauma Questionnaire to evaluate for PTSD. They used a symptom inventory to look globally for different symptoms. They developed their own questionnaire based on what their experience has been over the last 20 years that they've been serving these women. And key informant interviews as well. And what they found is that the psychological and health situation of most survivors of war rape remains extremely alarming. So in summary, you can find the study online, at least a summary version in English. Most of it is in Bosnian usually. But what they found is that 57% of their respondents were experiencing PTSD 20 years after the end of the war. More than 58% of them had more than 4 gynecological symptoms, and the most common ones that were cited were incontinence, chronic pelvic pain, which is an incredibly debilitating and difficult to treat syndrome, chronic vaginitis, and more than 10% reported having a malignancy, and very notably, more than 75% reported that their relationships with their husbands or men in general were very severely affected. And reading the accounts and reading the interviews is just very heartbreaking. So there are also lots of reports of social stigmatization, particularly within the healthcare system itself. So this really brings me to the meat of what I want to talk about, which is utilizing physicians in the concept of transitional justice is absolutely essential. We can contribute both as researchers and as care providers. So conflict epidemiology is basically evaluating illnesses, morbidity, and mortality in situations of conflict. And I would argue after conflict as well to assess the actual outcome of that on populations. Also importantly, we need to be able to provide compassionate and quality care. We have to commit to the mental health care in areas like this with an enormous need, access to quality services, and trying to get rid of the stigmatization of rape through personal interactions. And then finally, the general improvement of the healthcare system is absolutely essential in order to provide good care, not just for one group of people, but to elevate the status of healthcare in the country overall. So in terms of the epidemiology, the scientific research part, epidemiology in human rights has historically been underutilized. So lots of the research on human rights violations focuses primarily on case reports, case studies. Not a lot of formal sampling techniques or science is added to it, and they both have definite value. However, there is a real opportunity here for healthcare professionals to provide transitional justice through scientific research. We're in a very unique position where we see patients in a very systematic way, and this can help to validate the experience of survivors. So Physicians for Human Rights, who's probably my favorite organization these days, they, in 2002, they did a correctly sampled survey of refugees who were leaving Sierra Leone, and they were able to establish scientifically, according to women's testimonies, that it was the Revolutionary United Front that was committing rapes on a systematic level. And this was actually used to bring some perpetrators to justice. Similar surveys they've done in Kosovo, Afghanistan, and Iraq. We can also use the epidemiological study of these things to evaluate the true impact of human rights violations, which would be like the Medica-Zenica study, or the study that I was doing in orthopedics, where we were looking at all of the injuries that were sustained during the siege of Sarajevo. No one has really looked at it in depth, and no one has really cataloged these injuries, and it's very validating when you when you talk to people from Sarajevo, and they say how validating it is to have the department actually looking into it and trying to validate their own experience within the city. This can also be used to generate evidence to support policy decisions before and after conflict, hopefully, and it really just provides a concrete measure of the quality of life, the illnesses, the morbidity, and the mortality that are affecting people. The well-being of women in society is absolutely linked to national development, and without proper rehabilitation, women cannot rejoin society fully. And so it's critical that we're involved in the discussion of transitional healthcare as it's important that we're involved in the discussion of transitional justice as healthcare providers. So there's currently several different organizations that are providing healthcare specifically for survivors of war rape. The first one I already told you about, Medica-Zenica. They've provided over 400,000 patient contacts since they were established in 1993. Viva Gene is another one that provides rehabilitation services, psychotherapy, free of charge for women who have been affected by rape and torture during the war. And then Snaga Gene, which is the group that I primarily worked with in a clinical sense because they do the most clinical work currently. They do psychological counseling, social support, legal counseling, and clinical work in refugee communities where people have been displaced, and also in returnee communities like Srebrenica, where now people have a right to return, but are generally ostracized within that community. And finally, the last thing that we need to work on is the healthcare system in general. So the Dayton Accord in 1995, which was brokered by President Clinton in Dayton, Ohio, it effectively ended the war, and it continues to govern the country through its constitution, which was never really the idea behind it. It was not meant to be a permanent government. But the ability to function now is crippled by this ineffective presidency that rotates, and lots of bureaucracy and a struggling economy. And there is a civilian victim of war status under legislation, which was expanded to victims of war rape in 2006, which so relatively recently. And that's supposed to provide healthcare services and a stipend monthly, but only 770 women have actually attained this status since 2006. And if we think about the number of thousands that I was talking about who were raped, I mean, we just need to do a much better job. Also, the overwhelming majority of key informants who were interviewed by the Medica Zenica survey, they said that the governmental institutions really don't do a lot for survivors, and most of the essential support is provided exclusively by NGOs. And so the other thing I want to point out is that survivors really require the same health care as everybody else. This isn't a strange group of people that has different health care needs. They still have all of the same primary care needs as every other citizen of that country. So when a group has to seek health care outside of the system, it really just upholds the stigmatization and marginalization. However, the majority of survivors feel completely isolated and judged and discriminated against within the healthcare system. So it's a really difficult situation to be in. And I think that we can combat this on an individual level through positive interactions with healthcare workers. And so positive interactions with doctors, nurses, and clinicians were commonly cited by survivors as being the most positive predictive factor that they would return to the hospital and get the care that they needed. One woman remembers that a doctor said to her, "Whatever I say to you, I can't heal your wounds. How do I estimate what happened to you or to any other woman?" And survivors really commonly cited Medica Zenica, which used to be their primary form of health care, as the first place that they would turn to for medical and medical care and safety. So Koss and Harvey's paper in 1991 talks about post-rape trauma that survivors face globally. This is happening here, this is happening everywhere, that victims are faced with negotiating post-assault help seeking and ultimately their pathway to recovery within multiple hostile systems. And if they turn to formal systems, they may face disbelief, blame, refusals of help instead of assistance. So the trauma of rape extends far beyond the actual assault, and society's response to this crime can also affect women's well-being. This is the only hospital, and it's really more of a clinic in Srebrenica. So this is the clinic that I worked in with Snaga Gene on the weekends. And it's in desperate need of equipment and supplies and more personnel. And I think that provision of these things should be encapsulated within the definition of transitional justice. I'm very grateful to Branka, the infectious disease doctor there in the front, and Snaga Gene for teaching me so much and for their work within their communities, as well as the many other women who are working towards that. And I just want to conclude by saying there's an urgent need for more research in conflict, rape, and more need for long-term medical care for survivors. And Bosnia-Herzegovina is just an example, just one example of a conflict zone that's been left with an ineffective government and poor economy and a population that is in desperate need of better clinical care. So this shows that we as physicians really can be an important part of transitional justice globally. So while NGOs that provide the specialized health care for women and survivors, it's insufficient considering the number of women that have been affected by this. So in order to secure the success of transitional justice in this country and in any other country, it's essential that both the private and the public sectors fully utilize physicians as both researchers and healthcare providers. Thank you.
What was the hardest part for you personally in interacting with the women survivors?
I hesitate to say any part because I don't want us to view survivors of rape as victims who it makes it hard for me to work with them personally. In general, I mean, we were dealing with primary care issues, so doing blood pressure checks and just making sure that regular healthcare was being provided to women. And I mean, every once in a while, of course, you remind yourself of all the things that people have been through. But yeah, I wouldn't say that that was really hard. There were definitely difficult moments, I think, especially reading through a lot of the ICTY testimonials. It's really easy to get very dark and despondent. So I would say maybe that. But in terms of how hard it is to actually work with women who are survivors, I think it's actually the most validating and empowering work that I've ever done. So I just don't want to view these women as victims at all, or as a separate group.
Okay. Could you say more about how victims of rape in Bosnia-Herzegovina are stigmatized and ostracized within their own communities?
Yeah. So many of the things that people would report that were the most hard for them and the biggest predictive factor of depression, PTSD, was especially when families were not understanding or husbands were not understanding. Divorce didn't happen quite as often as I think lots of organizations expected it to in the aftermath, but that having the judgment or lack of support from the family structure, I think, was the most commonly cited example. And one woman gives an example of she received a letter from Medica Zenica in the mail, and the postman came up and said, "Oh, so you're one of those raped women." And so it's things like that commonly survivors would face. So it's not when you think about people being ostracized, it's the very small things that can really stick out in people's minds. So
there was a follow-up question to this, which I think you partially answered. How have women gained traction in addressing this problem in the past 20 years? And then there's another question: what about survivors' children?
Yeah, so I'll address the children part first. So many women also said that it was really difficult for them to explain what had happened to them to their children. About 43% of the respondents in the Medica Zenica journal said that their children did know what happened to them. But I think that they cited it as something very, very difficult to bring up and one of the hardest parts about their recovery. And then what was the first one? Sorry.
Has there been any traction made in the past 20 years?
Any traction made? I think that there's certainly more attention that's being brought to the subject, albeit very little. There is a feminist movement that is starting to gain a lot of traction in Bosnia-Herzegovina, and I'm hopeful that as a result of that community, more and more survivors will be able to seek out the care of the NGOs and then hopefully move more into the mainstream and the public healthcare system. But as of right now, I would say in the last 20 years, there really hasn't been a lot of traction per se for this population.
We have lots of good questions today. Are there other health concerns in Bosnia-Herzegovina?
Yes, there are. Anytime that you have a community that doesn't have a very functioning healthcare system, you're going to have a lot of health concerns. So, I mean, mostly it's boring things. It's not the things that NGOs really like to run in and talk to about, which I'm guilty of that too. I did a study on landmine survivors. Turns out landmine survivors have pretty good healthcare compared to other populations. It's really like all the patients with diabetes, with diabetic foot, who are living in super rural areas and can't make it to the hospital. And so their leg becomes entirely gangrenous and falls off. So, I mean, it's issues that you don't really think about as the international community as being particularly sexy or something that you want to get involved with. It's really the mundane things that affect all of us in the hospital here as well. So, but on a much larger scale.
And now there is a question, how are the other breakaway republics, such as Slovenia, Croatia, doing in this area?
So Slovenia, when Slovenia seceded, there actually, I think maybe either 8 people died or 8 people went to jail. It was not a big, it wasn't a big conflict because if you remember that map of the territories, there really weren't any Serbian strongholds there. So Slovenia kind of just left. When Croatia decided to leave, that was when things got very bloody. So there was a very awful loss of life in Croatia as well. They have recovered. I would say their economy is doing quite well. They've entered the European Union. They have the entire coast of Dalmatia. So there's a lot of tourist industry that's really helped with their economy. There is a very nationalist government, I would say. But yeah, those two are doing better, I would say, than Bosnia is at the moment. I'm also going to be a doctor. I'm not like an expert in international affairs, so I just want to throw out that caveat for everybody who's fact-checking me right now.
I think we want to do a little more fact-checking, and I think this is a pretty interesting story from knowing how Katie wound up in this country. What languages did you need to know? Did you need a translator? Would a physician need to know the language of the survivors?
Okay, slow down. Okay, give me one at a time.
What language did you need to know?
So the first time that I went to Sarajevo, I didn't speak the language at all. I gained a maybe very rudimentary vocabulary of 20 to 25 words that could get me like pizza and a taxi and a beer if I needed one. So the next time that I went, I actually enrolled in a course. I had a tutor, which Amy Wiseman, if any of you know, her husband is from Sarajevo, and he was my Bosnian tutor before I left. Mostly we just sat around talking. So I have to be honest, like my skills were not very functional at this time. So I relied primarily on translators, and my fortune is that I'm in the medical field, and the majority of anatomical words are the same-ish between languages, so we're all based in Latin. So that was easier for me than I think it would have been for a lot of people. But I would say I'm like maybe intermediate with Bosnian. And so if you don't know, in Yugoslavia, it was all called Serbo-Croatian, and then as each individual country came away, now they're all separate languages, but also kind of the same, basically. So I can technically say, like, I speak Bosnian, Croatian, and Serbian. Sort of.
And so would a physician need to know the language of the survivors?
And yes, like that's absolutely critical. I think it's one of the most important things whenever you're trying to decide where you want to go on medical missions and things like that. If you have any hope of actually treating your patients correctly, you absolutely need to speak the language. Translators and interpreters can only go so far, I think, and especially in cases where it's incredibly traumatic material. I also think that a foreigner providing psychological or psychiatric counseling would not be as effective as someone who has also been from that country and has lived through the same experiences. I just don't think it's as valuable, so I would never support that particularly. I think that international training is really where I see the medical future of global health going. So, no.
And we have one last general question. Is the EU providing help and assistance? If so, in what form? What more should they do?
Yes. I did talk to one of my very early projects in the area was a infectious disease project that was supposed to help Bosnia get into the European Union. It's a long ways away from doing that. So they are involved, and they're trying to meet the various milestones that you need to meet. The country itself is divided on whether or not they want to be a part of the EU. I'm actually really not that familiar with what they're doing within the country. So you would have to, Google their website and check it out. So that's all I know.
OBGYN rotation right now, right?
Outpatient internal medicine.
Okay.
Yeah.
So I think that's the end of our questions. We now conclude our program. On behalf of the Iowa City Foreign Relations Council, I give a big thank you to Katie for her presentation. I also thank our sponsors, the University of Iowa's international programs, the University of Iowa's Honors Program, and the Stanley UI Foundation Support Organization for their generous support. Again, we also thank our today's financial sponsors, Cartha and the University of Iowa Community Credit Union, and we thank City Channel 4 for making our programs available to viewing audiences. Katie, as a small token of our appreciation, we present you with a coveted Iowa City Foreign Relations Council mug.
Thank you.
Thank you again for joining us. We are adjourned.